Hi, I'm Dr. Judith Beck, president of the nonprofit Beck Institute for Cognitive Behavior Therapy in Philadelphia. And I'm so proud to present the 2022 Beck Institute Excellence Award to Estelle Richman. We created this award to recognize individuals, organizations, and initiatives that improve lives through the advancement of evidence-based practices in both the health and the mental health fields. We've had a number of illustrious past recipients, including Dr. Arthur Evans, who's currently CEO of the American Psychological Association. He did some groundbreaking work integrating CBT into community mental health centers here in Philadelphia. Dr. David M. Clark developed and spearheaded a very important and innovative program, the integration of CBT and other evidence-based psychotherapies into the national health system in England. Former U.S. Representative Patrick J. Kennedy advanced landmark legislation to establish mental health parity in the U.S. And Dr. Kay Kinsey contributed enormously to important public health initiatives benefiting vulnerable mothers and their children. I really encourage you to visit our website to learn more about the Beck Institute Excellence Award and really the inspirational individuals we've had the pleasure to honor. But today, I'm so happy to have the opportunity to acknowledge Estelle Richman for her 50 years of service in both the public and nonprofit sectors, and her important work creating and advancing systems that meet the needs of the most vulnerable individuals in our society. A lifelong public servant, Estelle has worked at the city, the state, and at the federal level, with a particular focus on vulnerable children and families, health equity, and systems change. In 1997, Estelle was one of the co-founders and former CEOs of Community Behavioral Health, CBH, which is a nonprofit organization. It was contracted by the city of Philadelphia to provide behavioral health and substance use services to Medicaid recipients in Philadelphia County. Well over 100,000 Philadelphians have used services covered by CBH. Estelle has also served as the Director of Social Services and Commissioner of Public Health in Philadelphia, and as the Secretary of the Pennsylvania Department of Public Welfare. At the federal level, she held several positions within the Department of Housing and Urban Development, including Chief Operating Officer. And she served on numerous foundation boards and nonprofit boards, including Beck Institute. She spent decades advocating for care coordination and providing relevant services that address all aspects of social determinants of health. Estelle's efforts have resulted in measurable outcomes, including a statewide increase in the percentage of foster children finding permanent homes, a drop in wait time for receipt of intellectual disability services, and improvements to child support collection services. Estelle created the state's first Bureau of Autism, ensuring that children on the autism spectrum and their families receive much needed support throughout their childhood and into adulthood. Here at Beck Institute, Estelle is known for her keen intelligence, her leadership, and integrity. Her experience and expertise in policy, public health, family and child welfare, health equity, education, and social services make her such an asset to Beck Institute as we continue our work to make evidence-based mental health treatment accessible to all. I'll now invite Estelle to speak more about her important work, and I'm sure you'll be inspired by her incredible expertise, leadership, and passion for public health.
Thank you very much, Judy, for your lovely remarks and for this distinguished award. I feel very honored to receive this recognition from the Beck Institute. This is very special as I knew and had many conversations with Dr. Beck. He was an icon and a hero to me. Cognitive behavior therapy has been an integral part of my professional life for 50 years. I started as a student of RET, Rational Emotive Therapy with Albert Ellis, and moved to cognitive behavior therapy with Aaron Beck. It has opened many doors for me and shaped me as an individual to become an effective professional and a leader. I truly am honored to receive this award. I want to take this opportunity to make comments in two areas. First, we have what we have learned from the perfect storm of now. And second, I'd like to share what I've learned from working in the human services field in the last 50 years. We are slowly recovering from 2 years of a perfect storm. We often refer to times when three things unexpectedly happen within the same time period and produce catastrophic results as a perfect storm. The three parts now are the COVID pandemic, the George Floyd spark of looking at racial inequality, and the unprecedented violence we are currently experiencing. The lemonade of the pandemic, which is slowly releasing its grip, is we must deal with health inequities. We must understand the relationship between physical health care and behavioral health care, and we must assure that people of color have real access to care. Even more challenges await people who rely on Medicaid and Medicare for their health care. Too often, they are at or below the poverty line. They are most often children, mom and dads, and people with co-occurring chronic diseases, asthma, diabetes, mental illness, and addictions. They are working at minimum wages, and often without health insurance. And yes, they have many other life challenges: unstable housing, food insecurity, fluctuating eligibility, work insecurity. Yes, as you know, the social determinants of health. They are making decisions every day about time off from work, whether they lose pay or make a preventive health appointment, whether to spend money on copays or food, copays or rent, and whether to get routine care or urgent care. We have known for years that our healthcare system is fragile and that the poorest among us are the most vulnerable. We have known for years about health disparities and the impact on people of color. And we have known for years that urban areas are extremely vulnerable for contagious diseases. However, the pandemic, COVID-19, hit us in the face with the reality. We can no longer move slowly to close the disparities gap. If we have learned anything from the trauma of 2020, it is racial disparities, health disparities, and moving slowly can no longer be tolerated. We have an opportunity to be intentional about our work to close the disparities gap, to improve health equity, and indeed to change our path to one of true health care for all. In many ways, those of you or those of us who work within the field of mental health are aware of and have struggled with this reality. We now need to come together, work together to find ways to use the lessons learned from COVID to improve our healthcare system. The death of George Floyd and those who died before and after him in a justice system that struggles with fairness taught us that we still have a ways to go to address racial equity. However, the lemonade here was bringing conversations into the light, having conversations at all levels that have been difficult but meaningful about racial issues in our country. We are moving the needle, albeit quite slowly. The third part of the perfect storm is still happening: the violence and substance abuse in our states, cities, and neighborhoods, and yes, in our rural areas, are impacted also. We are again struggling to understand the anger of our young people and how to give them hope for the future. I believe the answer to this one will belong to those of us in the mental health field. However, we need to reach out and understand how and why 6 and 8-year-olds believe they won't live to be 20 or 30. We need to understand why the staggering increase in drug overdoses in rural and suburban areas is off the chart. We need to understand why our culture has not given hope to these people. While the media reports on the gun violence in our large cities and the drug overdoses in our suburban and rural areas, we will struggle to determine solutions. We need to understand the true impact of trauma, not only on children, but their parents, teachers, administrators, and elected leaders. We need to reach out more to bring the private and public systems together to offer hope and interventions. And we, as mental health professionals, must lead the way to this solution. My last comments. In the past 50 years of being in senior policy and leadership positions at the city and county, state, and federal levels, I have experienced an awful lot, as you can imagine. Much of the learning has been through experiences, both good and bad. Sometimes I think I've learned more from my bad experiences than the good ones. However, I want to share just a few of my observations. First, leadership is important. Leaders must understand the political environment and how government works. We must begin to make that work with and for us. Leaders must understand financing and have a financial strategy. While we can blame everything on the government not offering enough funding or insurance companies not reimbursing enough, we must understand financial strategy and have one of our own. Leaders must have a media strategy. That media strategy needs to clarify, not muddle the water. We must be clear and intentional about our statements. Next, I can never say enough about strong communication skills. But from my perspective, it's not about talking, it's about listening. We must be good leaders. And one of the things I think I have learned time and again, the term active listening actually means listening, not planning your next comments. I think I have learned over these years that we need to set concrete but realistic goals. And the goals need to stress performance outcomes. We need to make decisions around whether something worked, about whether it gets us to the end point, not whether it was a good planning. We need to talk and listen to the people who use our services, consumers and families. We need to include them as often as possible in policy discussions. My basic belief is that if a policy is going to impact your life, then you need to be at the policy table to create it. We have a long way to go with this one, but I have seen true progress. We also need, within that same framework, work with system advocates, whether they are programmatic advocates or whether they're legal advocates. And again, the key is to listen and use them to shape good policy. We need to develop relationships and partnerships in everything we do. When I started writing this, in thinking about partnerships, it occurred to me you can never have too many partners. Well, I guess I don't want to make an extreme statement, but relationships and partnerships will really determine whether something works. We need to nourish innovation in ourselves and in others. Being innovative means trying something. Maybe no one gave you permission. Maybe no one said we need this, but you think there's a spot. You think there's a void. Nourish the innovation within yourself. Practice flexibility. It seems that as we both get older or more experienced or move to higher positions, we become rigid. Fight that. Practice flexibility. Listen keenly and begin to be as flexible as possible. Talk and encourage risk. Whenever I talk to or mentor young people these days, probably one of the things at the top of my list is encourage them to take risks. Most successful operations were viewed as risky when they started. Anything that's a gold standard now didn't start as a gold standard. It started as it's a good idea. And people continued to work with it and look at it, and it became shaped to become a good program. So take risks, encourage risks, and focus on making things successful. When starting a new project or starting any project, ask yourself, what does success look like? Don't proceed until you can articulate the answer. I've seen over the years way too many people in circumstances where people say, well, this is a good idea. I think I'm going to try it. But they have no clue what success looks like at the other end and they can't define it. Stop, think, and be able to answer the question, what does success look like? Let research drive policy and practice. You know, there's an awful lot of good research out there written across the world. And too often we reinvent the world rather than reading where the research is and letting that drive our policy and practice. Too many times I hear those working in the field not showing much respect for um, for research and policy. Consequently, it takes good research and policy 10 years sometimes to reach the place where it can actually influence what we do. That's way too long, and we need to find ways to make sure that we can drive that policy into practice much sooner. One of my favorite things I think I've learned over the years, and it takes focus and practice, is do not let the perfect be the enemy of the good. Way too often, we try to get to perfect. We try to make it really the right way. And in the process, we miss the change that can make things better. So while we always want to strive to make things the best we can, don't let the perfect be the enemy of the good. And one of my final statements is when given opportunities to volunteer, do it. And there's so many opportunities for volunteer work, whether it's on a board, whether it's at a school, whether it's just being part of a task force. But when you have opportunities to volunteer, take them. There's so much to learn and there's so much to give back. I want to close with a story about my grandmother. Estelle Eden was an educator. She taught at 2 historically Black colleges in North Carolina. For many years, she was the oldest resident in North Carolina, living to an age of 109. She was an avid traveler and incredibly independent. Her advice to me, my brothers and cousins, don't be like a crab in the barrel. When crabs are in a barrel, they all struggle to get out. They might crawl over each other as they compete to get free of the barrel. Once out of the barrel, they crawl away. As you achieve your goals, remember you never do it alone. Don't be like the crabs in a barrel and crawl away. Go back and help one other person achieve their goals. Let me say that again. Go back and help one other person achieve their goals. Thank you again for this incredible honor. And it's a pleasure to be here.